Hello, everyone. Welcome to the McMaster Health Forum here at McMaster University in Hamilton, Ontario for our latest Queen Elizabeth Scholarship presentations. Here's a quick agenda, if I can get the thing to advance. There it is, a quick agenda for today's presentations. I'm going to tell you a little bit about the forum, a little bit about our scholarship program, and then I'll introduce you to our scholar presenters. If you're watching this later on YouTube, the two scholar presenters will be divided into two individual recordings. The McMaster Health Forum aims to be a leading hub for improving health outcomes through collective problem solving. We harness information, convene stakeholders, and prepare action-oriented leaders to act as an agent of change by empowering stakeholders. The Queen Elizabeth Scholarship Program is formally referred to as the Canadian Queen Elizabeth II Diamond Jubilee Scholarship, and it's managed by Universities Canada, the Rita Hall Foundation, Community Foundations of Canada, and Canadian University. This program is made possible with financial support from the Government of Canada, provincial governments, and the private sector. The main purpose of the scholarship program is to activate a dynamic community of young global leaders to create lasting impacts both at home and abroad through cross-cultural exchanges encompassing international education, discovery and inquiry, and professional experiences. Here at the McMaster Health Forum, we've been lucky to have two different Queen Elizabeth Scholarship programs. Our second program, from which our two scholars come to today, we are very proud to have been selected as one of 20 Canadian institutions for a second round of scholars. It began in 2018. It was originally supposed to run to the end of 2021, but we were given an extension for obvious reasons to 2023. The focus of this current version of the scholarship program here at the Forum is called Strengthening Health and Social Systems. Our scholars will contribute to strengthening health and social systems, become part of our large and growing network of health and social system leaders. This on the screen now, you'll see a number of scholars from our previous scholarship program. We had 14 incoming scholars, and we had 3 outgoing scholars. And that program had 44 outgoing interns, all of whom are listed on the screen there. In terms of our current Queen Elizabeth Scholarship Program, we've had 7 incoming scholars, and you're going to hear from one of them today, and we've had 24 outgoing interns. Our scholar presenter today is Ariana. Ariana is currently pursuing an honors degree in arts and science here at McMaster University. Through her work, academic pursuits, and volunteer experience, Ariana hopes to deepen her understanding of how marginalized communities are situated in the healthcare system. During her internship, Ariana hoped to learn about the unique mandates of health systems governance and how health research is used to influence and guide policymaking. Ariana, I'm going to turn it over to you.
Thank you. All right, so on my QE experience. So during the 3 months I spent at the ministry, I had the opportunity to engage in various types of work and projects, all contributing to the goal of strengthening health and social systems in New South Wales. The Centre for Epidemiology and Evidence was particularly focused on strengthening health and social systems in NSW through the use and evaluation of the best available evidence. I had the opportunity to engage in a wide range of health policy projects and develop new technical skills for further health and social systems research. I primarily worked with the strategic projects team in the CEE, but also contributed to projects being undertaken by the Strategic Research and Evaluation team and got to hear about the work of all other groups during the center meetings and webinars. These meetings allowed me to gain a more comprehensive understanding of the ways that the ministry is structured to adequately address the wide range of health and social needs in the state. These meetings also often featured presentations by public health officers, team managers, executive members of the Ministry of Health, and government officials. I had many great opportunities to ask experts in the field of public health about their work and varying experiences. I was given the chance to attend 2 workshops run by the CEE during my internship, which gave me the opportunity to gain some deeper insights into how public health research is created and used in a government organization. The first was a workshop about how to conduct economic evaluations. This was facilitated in collaboration with the Hunter Medical Research Institute and provided us with an overview and understanding of the process and value of using economic evaluation in public health research. This not only gave me the chance to develop a new set of skills and knowledge about how to perform an economic evaluation, but also widened my understanding of how data is used in various forms to cater to different information needs. The second workshop provided an explanation of program logic models. While I've encountered similar structures before in research work, this was the first time I had the opportunity to critically assess and understand their use and value. We learned strategies to create program logic models. We examined existing models being used in the NSW Health system, and we worked collaboratively to create our own models for various case studies. Both workshops administered by the CEE provided me with hands-on knowledge and experiences that will be relevant and crucial in all aspects of research work as I continue throughout my academic and professional career. So into the specifics of the projects I got to contribute to during my time at the ministry, the first one was the COVID-19 Impact Evaluation Report. This report was designed to be made publicly available and aimed to assess the value and outcomes of the COVID-19 research projects funded by the NSW government during the pandemic. I began by compiling metrics of the studies included in the report to make the information easily accessible in the final product. We as a team worked on writing narratives for the featured research projects and provided a brief summary of the outcomes and the impact of the results that the results had on the COVID-19 response in New South Wales. We attended progress and planning meetings as a team and with the researchers of the studies. This project was an example of the ministry's continuous effort to evaluate its initiatives to better shape future actions, and it gave me a firsthand insight into how research helps directly shape policy and public health responses in an area. The second project I worked on was a follow-up to a previous review that aimed to assess strategies to improve health policy decision makers' uptake of evidence from research into policy and decision making. I was asked to help develop an initial protocol and literature searching strategy for this project with the SRE team. The study covered how researchers and policymakers work together, barriers and facilitators to the uptake of evidence from research in policy, dissemination of and access to research findings for policy, and incentives for increasing the use of research in policy. While they were different projects, I found that the underlying theme of this project aligned closely with the next and final project I had the opportunity to contribute to. This was a review that aimed to evaluate the effectiveness and methodologies of evaluation capacity building strategies. This review is still being conducted by the SRE team and contributes to the aim of fostering a culture of effective evaluation in New South Wales. Two other reviewers and I independently extracted data on what kinds of interventions have been used to build evaluation capacity among organizations and how these interventions were evaluated. The studies included in this review were far more qualitative and much less systematic than the articles I've been used to working with at the forum, so they demonstrated a new dimension of policy research. The underlying discipline of both of these projects was a commitment to ensuring that government health systems are structured in a way that guarantees people living in New South Wales access to health services that are up to date and regularly appraised. I was initially drawn to health and social systems research because I was interested in the intersection between the humanities and science. So this was a really impactful way for me to see this intersection applied in actual health policy. I'm incredibly grateful to have had this opportunity at the ministry. I got to try completely new tasks as well as hone skills that I've been using throughout research work already. I had wide exposure to the many teams, roles, and projects at the ministry, deepening my knowledge of the intersections between health evidence, research, and policy, and I got to develop a particularly refined understanding of the NSW health system. So now for the fun part. I will need to keep an eye on the time for this part because anyone who's had the chance to talk to me in the last 4 months can tell you that there's no limit to how much I can gush about what an amazing and unique city Sydney is. Luckily, I didn't have too much of a cultural adjustment because it is an English-speaking country, and I was lucky enough to have some friends and family in the city already. In addition, we had a really lovely big group of QE scholars from McMaster there at the same time who were working at the Sachs Institute, so there was always a little piece of home. The girls and I had a lot of fun exploring everything the city had to offer, from food and coffee to landmarks and nature and everything in between. The ministry also offered me lots of experiences to explore Sydney as a local, and it was also situated in a well-connected and beautiful area of the city. On that first slide, that was actually a picture from the view of the office, which was that beautiful Sydney skyline with the bridge and everything. One of the opportunities that they gave me was the chance to attend a rugby game, which was a lot of fun and I actually had no idea what was happening during the game, but Daniela, who was another QE scholar at the Saxon Institute, and I had some chips and we had lots of chicken salt on them, and we enjoyed the atmosphere anyways. While there were always people that I could spend my time with, I really value the opportunity to live entirely on my own and experience the city on my own time. I spent my weekends hiking and taking in the famous Sydney sun and wonderfully mild winter weather. The experience gave me the confidence to travel and explore on my own in a really special place. So pictures I have here are from all of these little excursions. The first one on the top left is actually from Mrs. Macquarie's share, and that was the first time that all of us QE scholars in Australia got together and got to meet each other formally. We decided to walk from the Opera House to Macquarie's share to get that beautiful sunset view of the Opera House and the Harbour Bridge and the harbour. Below that is the rugby game that Danielle and I attended, and I'm sure that rugby is a really, really interesting sport. And at some point, I really do aim to learn how it works. Top right, we have a little guy from Taronga Zoo, which was really another highlight. The wildlife and nature was a really phenomenal part of Sydney. There was no shortage of it, even on public transportation and walking through. There was so much greenery and natural beauty to be offered. And so for Danielle and I, who actually also went to the zoo together, seeing the koalas and the wallabies was a really lovely way to cement our Australian tourist experience. Bottom right is from a lookout from the Royal National Park in Sydney. This was one of my friends who was a local there. This was actually a couple days before I left, and he had told me that there's no way I can leave the city without seeing this park. So we went on a drive through it and got to look at this really wonderful lookout of the beach and the mountains. And this was really one of my favorite experiences because it was a pretty rainy and gray and cloudy day, but even still, it was such a beautiful lookout. So even without its signature sun, I was just reminded of, how much really wonderful scenery the city had to offer. And the last one in the center there, that's from a lookout point at Palm Beach. This was a really rewarding experience because it was quite a steep hike. And this was quite late into my Sydney excursion. So I'd gotten a little bit used to the intensity of Sydney hikes and how much effort it actually takes to get to these beautiful places. So it was really rewarding to get there and, take in the kind of idyllic Sydney scenery that we're all used to. So my time at the ministry and in Sydney might have been one of the most memorable and valuable experiences of my life, and I eagerly look forward to any opportunities in the future that might allow me to go back and extend upon any of the work that I've done in health and social systems research.